In recent years, adult content has become more accepted in mainstream culture, shifting from a once taboo topic to one openly discussed in society. With this normalization, we're now able to explore its effects more objectively, analyzing how it impacts individuals and society as a whole. This cultural openness has also shed light on the addictive potential of adult content, with many people acknowledging that they find it difficult to quit. Recognizing this habit for what it is can be one of the hardest steps toward overcoming it. Whether you're unsure if adult content is truly addictive, or you're struggling with it yourself, here are some psychological insights that might help illuminate the journey toward healthier habits. 1. Recognizing triggers. As with any other habit that can lead to dependency, adult content use often comes with specific triggers that make quitting a challenge. These triggers, whether visual, verbal, or situational, can activate memories and desires tied to the habit. Trying to avoid adult content can reveal just how embedded these triggers are in daily life, from media portrayals to advertisements and even social media posts. For instance, if someone frequently views animated adult content, simply seeing similar animation styles or topics might reignite the urge to revisit that habit. Conversations around intimacy, jokes with sexual innuendo, or even innocent images that evoke related memories can all serve as triggers, pulling the mind back toward familiar urges. Unlike substance dependencies where physical removal is possible, adult content is woven into our digital environments, and it doesn't require any physical purchase or significant effort to access. 2. The challenge of maintaining sobriety. Maintaining sobriety from adult content is a challenging but achievable goal. With its constant availability on devices we use every day, resisting the urge to revisit the habit can feel like an ongoing test of willpower. Simply scrolling through a social media feed or browsing the web may be enough to spark temptation, which can make it hard to envision a life without it. Yet sobriety is possible with personal accountability, commitment, and a strategic approach to avoiding known triggers. Part of this journey involves accepting that, as with any addiction, relapses can happen. While disappointing, a relapse can serve as an important step in recognizing the grip that adult content may have over one's mind. This setback can reinforce a renewed sense of purpose in the journey, highlighting that while it's challenging, it's far from impossible. Understanding the cues that lead to these lapses and learning to navigate them is crucial in developing a lasting path to recovery. 3. The ambiguity around addiction. Classification. One of the most significant challenges in addressing adult content dependency lies in the ambiguous classification of what qualifies as an addiction. Unlike substance abuse, where addiction is clearly defined and acknowledged, adult content dependency isn't universally recognized as an addiction in the same sense. Instead, it's frequently referred to by mental health professionals as compulsive sexual behavior disorder or problematic adult content use. These terms emphasize the compulsive nature of the behavior, highlighting how it can disrupt daily life without being classified as a chemical addiction. This lack of universal classification doesn't prevent mental health professionals from offering support or intervention. Researchers continue to study compulsive adult content consumption, while therapists work with individuals to help them identify their triggers, set healthy boundaries, and ultimately develop a balanced and mindful approach to intimacy and self-control. Recognizing it as a problematic behavior rather than strictly an addiction makes room for new perspectives on recovery. 4. Physical and chemical effects on the brain. Beyond psychological effects, there are real physiological impacts to consider with frequent adult content use. This kind of behavior has been linked to increased levels of brain chemicals like dopamine, serotonin, and norepinephrine, all of which play key roles in mood and reward processing. When the brain becomes accustomed to receiving these intense bursts of chemicals through adult content, it can become challenging to find enjoyment or stimulation in everyday life. This shift can lead to feelings of apathy, emotional flatness, or a general lack of interest in regular activities. Neurological studies, including those by Dr. H. Quadri and colleagues, highlight that excessive adult content use can lead to psychological issues like anxiety, depression, sexual dysfunction, and dissatisfaction. This imbalance in brain chemistry can impact mental health, creating a reinforcing cycle that complicates the process of recovery. Root causes: adult content use as a symptom of larger issues. For many individuals struggling with dependency, there's often a complex background of personal history and unaddressed emotional needs. Addiction rarely exists in isolation. Underlying mental health issues, relationship struggles, or low self-esteem may contribute to the tendency to turn to adult content as a form of comfort or escape. In these cases, the dependency can act as a coping mechanism, providing a temporary release from stress or unhappiness. Since adult content can trigger the release of dopamine and serotonin, some people may use it to alleviate symptoms of depression or loneliness. This creates a feedback loop where negative emotions lead to dependency, which then reinforces those same negative feelings. In treating adult content dependency, addressing these deeper issues is often necessary to prevent a return to the behavior, as simply focusing on the symptom without tackling the root cause may only provide temporary relief. 6. Escalation of use and hypersexuality. Though many people view adult content as a way to manage sexual urges, over time, frequent use can actually increase preoccupation with sexual thoughts. Rather than satisfying these urges, excessive consumption can disrupt sexual health and even increase dependency. A study published in the Journal of Clinical Medicine notes that frequent adult content use has been associated with higher levels of sexual dissatisfaction and dysfunction among both men and women. The more someone consumes adult content, the more they may seek out increasingly extreme or unusual content to achieve the same level of satisfaction. This desensitization can lead to escalating habits and, paradoxically, less fulfillment. The cycle of seeking novelty in adult content, while feeling dissatisfied in real-life relationships, can be difficult to break and may have serious implications for personal and romantic relationships. 7. Impact on relationships, love, lust, and everything in between. Whether or not one sees adult content as addictive, it's hard to deny its impact on relationships. Many people find that excessive consumption can lead to dissatisfaction or a sense of disconnect in real-life relationships. Although not everyone who watches adult content will face relationship issues, it can affect expectations around intimacy and increase the tendency to seek new experiences outside of a committed relationship. In relationships where one partner is uncomfortable with adult content, frequent use may be perceived as a form of infidelity, leading to feelings of hurt or insecurity. Meanwhile, the partner engaging in frequent adult content use may find themselves struggling with boredom or a lack of satisfaction in their relationship. Like any addiction, realizing that adult content consumption has become a problem is a deeply personal journey, and moving toward change requires self-reflection, honesty, and a commitment to re-establishing trust and intimacy in relationships. Closing thoughts. Anyone can find themselves facing a dependency on adult content. Its accessibility and presence in so many parts of our digital lives make it easy for habits to form. Acknowledging a struggle with adult content can be a powerful step toward lasting change. Taking ownership of this journey allows for a path toward healthier, more fulfilling relationships and personal well-being. Do you think adult content dependency is more or less common than people think? Let us know your thoughts in the comments below. And if you found this discussion insightful, give it a thumbs up and subscribe to Sci2 for more videos on mental health and personal growth. Good luck on your journey.